Welcome back to TV5 News at 9. When cancer returns after a period of remission, it's called a recurrence. How likely cancer is to recur depends on the type someone has. But even the thought of recurrence can be stressful for cancer survivors. Calling in this morning to tell us more, we have Dr. Brian Ye, radiation oncologist at the McLaren Proton Therapy Center. Thanks so much for being here.
Thank you for having me.
So Dr. Ye, how common are cancer recurrences?
So as you mentioned earlier, it depends on the type of cancer as well as the stage of the cancer. For example, for early stage, prostate cancer, early stage breast cancer, and even early stage lung cancer, cure rates are very, very high, and the risk of recurrence is in the single digit percentages. So 1 to 5% for early stage prostate, breast, or early stage lung cancer. However, for much more advanced stages of either prostate, breast or lung cancer, or even early stages of very aggressive tumors, such as there's a specific type of lung cancer called small cell lung cancer, or a specific type of aggressive brain tumor called glioblastoma, recurrence rates are greater than 50% for those. So it depends on the type and the stage of cancer, but we do have a lot of cancers which, we have very, very high cure rates and very, very low recurrence rates.
That's good to know. And how important is it for someone who's already had cancer to have regular screenings, and is the frequency different for cancer survivors?
Yes, so it's very important for everyone to have regular cancer screenings. It is different for cancer survivors. Part of it is because once you've had one type of cancer, sometimes you're at an increased risk of developing a second type of cancer. For example, patients who've had lung cancer, sometimes it's because they've been exposed to certain, certain pollutants in the air, or because of a tobacco history, and that might increase the risk of getting another lung cancer. So those patients sometimes are screened a little bit more frequently. Usually, for example, in patients who have a history of smoking, we do recommend annual CTs of the lung to screen for lung cancer. But after a diagnosis of lung cancer, sometimes it might be more frequent. It might be every 3 to 6 months.
Now, we're told treating a recurrent cancer with radiation can be risky for patients who have recurrences. Why is this, and how does this play into proton therapy as a radiation option for these patients?
Yeah, so we frequently use radiation therapy to treat cancer. Radiation therapy sometimes it can damage some of the organs near where the cancer was. Now, if the cancer comes back and the patient needs more radiation therapy, then sometimes we need to be careful about how much additional radiation therapy we give to the organs that are near the tumor. Proton therapy is a newer form of radiation therapy that's a little more focused. It actually delivers less radiation to the normal organs around the tumor. And because of that, it is considered safer, especially in patients who need radiation a second time. I actually have a little picture to share here. So this right here is a picture. Of the top is a patient with lung cancer being treated with proton therapy. And below is the same patient with a X-ray therapy plan. And you can see here that in the top, and the colors, the different colors from blue to red are different doses of radiation. But you can see here on the top pictures on the proton, this is a patient treated with proton therapy. The proton plan is much more focused. There's less radiation going to other parts of the body. Here you can see, I don't know if you can see here, this is the heart that's in front. The black areas around are additional lung, and then this here sort of it's on the left side of the screen. Everything in medicine is flipped left and right. So that's this little circle on the left is actually the liver, but it's actually on the right side of the patient. But you can see here on the proton plan, the radiation is a lot more focused. Here on the bottom of the IMRT plan, which is a type of X-ray therapy, you can see here that there's a lot more radiation going to the heart. Additional areas of the lung, they get a lot more radiation.
Well, that is fascinating to see. Thank you for helping us visualize what we're talking about here. It helps it break it down.
Yes, so when patients get proton therapy, there's less normal organs that are getting radiation. So it's a safer form of radiation therapy, and patients are getting radiation therapy for a second time.
Now, McLaren Proton Therapy Center is one of only 2 in the state right now to offer this treatment option. Dr. Ye, how can someone newly diagnosed with either a recurrence or a brand new cancer find out whether proton therapy is an option for them?
So the best way is to give us a call. We have intake specialists who are nurses who are medically trained, and they can determine whether or not proton therapy is an appropriate treatment for you. The best way to reach them is to call our phone number. It's 855 MY Proton. That's spelled MYPROTON. That's 855 MYPROTON. Or you can go to our website, which is mclaren.org/proton therapy.
We appreciate you so much. Dr. Ye, thank you again.
Well, thank you for having me.
Of course. As always, you can find more information on today's topic by going to our website. Just click on the hot link section, WNEM.com.